Okay, did somebody wipe this off?
Yes.
Okay.
Maybe.
Who's going to be the patient?
I will be.
Okay. So we want to make sure that we have our shielding, even though at the gonadal area where we're collimating correctly, we shouldn't need it. So, but you have to because that's our requirement. Correct? Correct. It makes everybody feel better, and if you're not centered correctly or if there's some problem with your equipment, then they're shielded. Okay, so if you have a sinus series, what are the general views? A PA, a waters, and a lateral. That's it. It's that simple. Okay, so we don't need to be AP, correct? We want to ask all the important questions. What type of, how do we get our patient dressed?
No earrings or necklaces.
Did that task analysis, it had sinuses on there, didn't it? Or was that just skull? Had everything? It's pretty much
and waters.
Okay, so it's all the same for skull and sinuses as far as getting them dressed. We want to make sure we remove any hearing aids, dentures, hairpins, etc., necklaces, but piercings, correct? And we also are going to do an SMV as well, so I think we left that one out. So we're going to start with our patient prone. Of course, if it's a female within the childbearing years of your facility, you want to do a pregnancy test, not test, but verbalization.
I'm not pregnant.
Just to clear that up.
Yeah, it's okay. And if you were, that's okay. So you guys know our pregnancy policy,
Yes.
right? Mm-hmm. What is it?
You got to declare if you want to get a special badge, fetal badge, and all that kind of
Do you have to declare?
No.
You don't. It's all up to you, right?
Right.
So, and there's several options if you do declare pregnancy that you can continue on with no modifications, a whole bunch of other different things. Or, you know, you can just non-declare. Or anytime during the pregnancy, you can say, retract that and say, I no longer wish to declare pregnancy. And we would treat you just as if you were not pregnant. Okay? Just so that we let you know that that is our policy. And it is in our handbook.
Well, every time a screening thing comes in the department, my uterus shrinks a size.
Okay. So we're going to have our patient face the image receptor. And what's our positioning point? We're going to start with our Caldwell. Okay, we're going to do 0 degrees because we don't want to really have, or not a Caldwell, just our PA. How do we want our patient up against the image receptor?
Forehead against the image.
Forehead, right? Forehead, you're going to tuck the chin down. And you want the IOML or the OML perpendicular image receptor? OML. Correct, good. So I'm going to lower this down just a little bit. Keep your face just like that. Okay, go ahead. Good. With the PA, do we want any angulation?
No.
No, we do not. So what's the important thing now? What do we want to make sure where we exit?
That the CR exits the nasia.
No.
Labella.
Labella.
No. Yeah. So we want it to exit the glabella. What do we want to make sure that the face is not what?
Rotated.
Rotated.
Tilted.
Very good. Are we sweating or what?
Yeah.
We'll make this quick.
Gotta get some face mysterio.
Smells.
That's what I'm
Yeah, I'm not going to change. Okay, so it's right about the glabella. So what I need to do to my, here, line it up. Okay, so I would move it. Yeah, she is sweating. It is sweaty in here. What kind of breathing instructions do we want to give?
Suspended respiration.
Suspend respiration. We're not going to say suspend respiration now. We're just going to say, okay, I want you to hold real still. Don't breathe. Don't move. Go back here, make your exposure. But what am I forgetting on here? Marker. Which side are we going to mark? Does it matter?
No.
No, it doesn't matter. When does it matter? When you're doing your lateral, because you want to mark the
Correct.
correct side. Correct. Yeah, the correct the side being demonstrated, which is the side that's down. Okay, so put our marker on there. Any questions? All right. So since we have our patient in this position anyway, what should we do next?
Caldwell.
We can do a Caldwell. If we do a Caldwell, if